All right. Good morning. Thank you all for being here for the COVID-19 vaccine media availability. We have a little shift in this programming today. We have James English from our COVID-19 response team. Kevin Dick, the district health officer, is monitoring the BCC meeting or the Board of County Commissioners meeting on local control, so he will not be on today. But we do have Heather Kerwin, who's our epidemiology program manager at the Washoe County Health District. They will also be available for Q&A after, but we'll go ahead and get started. I just have a quick update. In terms of scheduling for the vaccine, we still have plenty of appointments available for the week of the 19th. We understand it's a little far out, but there are appointments available. One important thing that we really need to stress to people in terms of making sure that our lines keep going smoothly and ultimately they get the vaccine as soon as possible is to make sure that they fill out their questionnaire in advance. The new process that we're using with the scheduling tool allows you to do that on a computer. It's a couple simple questions. It's just kind of gauging, making sure you don't have any reactions and just letting our staff know if you do. Also in the confirmation email that you get with your appointment number and all that, there's a QR code. You can either print that out or bring your phone so we can scan it, and that speeds up the process quite a bit. So it's just really important to make sure you fill out that questionnaire, bring that QR code to your appointment, and we'll get you in and out as soon as possible. And if you guys don't, and if they don't bring those, it's okay. You can still get the vaccine, but it does limit the process a little bit. All right. Looks like we'll go to, first off, we'll have James English and then Heather. So James, if you're ready to go, please start us off.
Good morning, everyone. First off, I'd like to thank Scott for giving those updates. We have switched our scheduling platform, so it is imperative that everyone go to covid19washoe.com to schedule your appointments and completely follow all the steps to complete your questionnaire when it prompts you to, and make sure you have that QR code. You'll get through our facility extremely fast. That way it'll be much easier, and you won't have to be pulled off to the side to complete all that with a National Guard member or a nurse. I'd also like to thank Heather Kerwin. She's one of the driving forces behind the disease investigation and epidemiology sections of our response, and she helped guides our mission and our operating response to this pandemic. So as I mentioned, Monday we did move testing from the south end of the pod post to the north end. That has allowed us to continue to vaccinate more and more people every day. Since the last briefing on Monday, we've completed over 3,000 first doses and an additional 3,300 plus second doses. We're also doing homebound at 10 visits a day, 5 days a week. And if people need homebound vaccinations, I want to stress to please call our call center. We do have ample capacity to do homebound vaccinations, and we can get you in within a few days. The other item I want to bring up and really stress is with our new scheduling platform, there's an option to choose your vaccine. We have a very limited supply in all of Washoe County for the Janssen or J&J product. Next week, the entire Washoe County region is only getting 500 doses of that vaccine. So it is not readily available at any level. And we will attempt to use it at least one time a month. But right now, we do not have enough Janssen to actually operate an entire shift at our pod, and neither do our regional partners. But there is plenty of Pfizer and Moderna, and I do stress that everyone that is able to get a vaccination, please try to schedule as soon as possible. This Saturday, we're doing all first doses. We're also partnering with the National Guard. Since we have the regional asset of the pod, we want to utilize it the best way possible with all our tax dollars. So the National Guard will be running their active military members from the bases and their family members through this Saturday on our quote unquote lunch break to do second doses. We offered the pod to them to run their first doses, just as we've offered it to other operations to utilize when we're not using it, so that it stays as busy as possible. And with that, that's the end of my report for today.
All right. Thank you very much for that, James. We'll pass it now to Heather Kerwin from the Washoe County Health District.
Thank you, Scott. This is Heather. I just want to drive home a couple of points. We are seeing an increase in case counts. This is due to a myriad of different factors. Of course, we have some of those B117 or UK variant clusters that we're following. We have several cases linked to these clusters that are not confirmed to be B117, but highly suspect to be. This is estimated, this particular variant is estimated to be about 30 to 50% more infectious. And so definitely trying to keep our pulse on that and continuing our contact tracing efforts so that we can mitigate the spread as we start gearing towards the May 1st and hopefully returning to some sort of new normalcy into the year. We're really starting to see some people decline testing because they perceive what are actually symptoms to be allergies. And we saw this also last spring as well. March, April, May, things start warming up and those plants are blooming. And even if you do have seasonal allergies, if your allergy medications that would typically work for you are not responsive, or this is your first time developing allergies, you may want to go ahead and just consider to get a test to be safe. And you know, you never really can tell unless you do get tested. A lot of the symptoms of COVID mirror other respiratory illnesses, pathogens, and unfortunately allergies as well. On that note, there have been some questions about vaccine and vaccine efficacy. Again, no vaccine for any pathogen is at 100%. We have had breakthrough cases, which is what we call when somebody tests positive after being fully immunized, which means they've received their final dose in the series. If it's a 2-dose series, or if it's Janssen, it's a single dose. And 2 weeks later or more, later than that, they become infected with SARS-CoV-2. Those are those breakthrough infections. We have experienced breakthrough infections with all 3 vaccine types, but none of the vaccines are directly comparable to one another because during clinical trials, they were held during different times and in different geographic locations across the planet with different kinds of variants that were predominant in certain locations. So the efficacy rates really can't be compared from one vaccine to the next. So again, just to reiterate what Jim English was saying earlier is please go ahead, sign up to get vaccinated. That is how we'll stop and slow down this spread ultimately, and get whichever vaccine is available to you at a location and time that works for you.
Thank you very much for that update, Heather. And now we have Melody Osborne from Renown Health, who also has an update.
Good morning, Scott. Thanks for the opportunity to provide this update. So Renown has completed more than 53,000 dose 1 and dose 2 vaccinations to date, which includes our Tier 1 medical staff members, our Renown Health employees, students, volunteers, and our eligible community members. This week, community members who are 16 years and older are receiving their COVID-19 vaccines through Renown. Our initial appointments have booked up quickly, but we do have open appointments later on this month. So please make sure to book your appointments. Over 300 of those appointments have been scheduled for our 16 and 17-year-old population to date. We want to ensure our parents and guardians that the Pfizer vaccine is the only FDA-approved COVID-19 vaccine for teens, is safe and is effective. Vaccinating children will be critical to slowing the pandemic and will be a tremendous help to our parents, grandparents, schools, our teachers, and our vulnerable populations. We have made special arrangements for minors ages 16 and 17 to get that vaccine. To make a vaccine appointment for those 16 and 17-year-olds, please complete the form that is located in the chat, and a Renown representative will be calling to arrange that vaccine within 14 business days. Anyone aged 18 years or older may register for Renown Epic MyChart. They do not need to be a Renown patient or see a Renown provider to enroll. With a MyChart account, you are able to log in and schedule your first vaccine appointment. For second dose appointments, those second dose appointments are available now for individuals who have received their first dose through Renown. Please log into MyChart to self-schedule your second dose appointment at your earliest convenience. It's really important that you schedule your second dose appointment. Now, if you received your first dose appointment somewhere other than Renown, but want to schedule your second dose with Renown, please make sure that you validate that you are scheduling for the correct vaccine for your second dose. For example, if you received Moderna for your first dose, your second dose also needs to be Moderna. Currently, we have 2 Moderna clinics scheduled for our dose 2 population, scheduled for this month on Saturday, April 10th and April 17th. The remainder of our vaccine clinics are scheduled for the Pfizer vaccine. Those are my updates, but ongoing updates will be provided at our covid.renown.org vaccine site. Thanks again, Scott.
Thank you very much, Melody, for that. I'm just going to share my screen real quick with you guys. We got an update on the scheduling tool that we use through the Salesforce platform. In the past, obviously, there's going to be concern with people scheduling appointments in Las Vegas. There was an update made recently that actually utilizes the zip code data a little better. So if you put in your zip code, and notice I'm on the 8th here, we don't have any appointments this week, so it's going to tell you that there isn't any. But if you click on the week of the 19th, it only will show the ones in Washoe County, and you can adjust the mileage if you're looking in Carson City, which is going to be using this tool as well. So I just want to make sure that's clear. It's just a little easier for people to find appointments that are in Washoe County. So we'll open it up to Q&A. We have James English, Heather Kerwin, Melody Osborne from Renown, and we also have Dr. Anderson from Northern Nevada Medical Center. So if you have questions, please direct it towards the person you want it to answer, and I'll stop talking and let you guys go ahead.
Hello, Scott. This is Scott Sonner at AP. I had a question, I think, for Heather, referencing the breakthrough, the infections of people vaccinated. Does this mean that you guys are tracking what happens to folks after they're vaccinated? And do you have any numbers on that? And are you aware of any deaths that have occurred among people who have been fully vaccinated?
Sure, happy to answer the question. So we do not track individuals after their vaccine here at the Washoe County Health District. A lot of the tracking that occurs is done through that VSafe app that CDC has. And then, of course, if you experience serious side effects of the vaccine, your provider can fill out a VAERS event, is what it's called, and submit that to CDC as well, which is a much more in-depth documentation of what happened after receipt of vaccine. We are really only notified of breakthrough infections when somebody seeks testing and tests positive. And then through our questioning, we determine whether or not they were vaccinated, the doses of their vaccines, and when their symptom onset and exposures were post receipt of those vaccines. I run the numbers every week on Thursdays, so I don't have an update. As of last week, we were sitting at about 25 breakthrough infections, which are super low. But again, we're probably not capturing everybody who's been vaccinated and then has been exposed and potentially gone on to develop really mild symptoms or asymptomatic, which means lack of symptoms, which many of these breakthrough cases are. So again, it's proving that that vaccine's effective and that it's preventing even moderate and severe SARS-CoV-2 infection.
Any other questions from media? All right. Thank you guys very much for being here. Thanks to all our guests. If you have anything further, feel free to reach out to me. And thank you for your time.
Thank you.
Thank you.